Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone. Welcome back to another episode on the Health Trip Podcast. Human papillomavirus, or HPV, is a sexually transmitted infection that can affect women of all ages, including those in midlife. This topic is not discussed enough in the menopause metaverse, and I wanted to bring more awareness to it. Most of us have heard of HPV and may even have kids who were vaccinated over a decade ago and who are now young adults. Over 42 million people are infected with the HPV virus in the US alone. At least 80% of sexually active women will have been infected with HPV at some point in their lives, and at least 4 out of every woman will have been infected by the age of 50. Most HPV infections clear up on their own within a couple of years, but high-risk HPV infections that persist can lead to cancer, including cervical cancer, cancer of the vagina, cancer of the vulva, and cancer of the anus in women. About half of all cervical cancer cases occur in women over 50, and more than 20% are found in women over 65 years of age. These cancers are rare in women who have had regular cervical cancer screenings before age 65, and there are 4,000 deaths every year from cervical cancer, and it is preventable. One issue I see and read about is that many women who are past menopause stop seeing their OBGYNs on an annual basis, meaning that they are not continuing to be screened. My guest today will share an incredible amount of information on HPV, including how to strengthen our immune system to clear the virus, how our gut and vaginal microbiomes affect our immune system, the importance of micronutrient status on a cellular level, different protocols to follow to clear the virus, and what screening should look like for you. Mindfulness also plays a pivotal role in supporting menopausal women in clearing HPV and promoting overall health. Stress has been shown to weaken the immune system, making it harder for the body to combat persistent HPV infections. By fostering a calm state and reducing chronic stress, mindfulness practices such as meditation and deep breathing can enhance immune function, potentially aiding in the clearance of HPV. Additionally, mindfulness helps women cultivate greater body awareness and resilience during menopause, a time of significant hormonal and emotional changes. This holistic approach empowers women to take proactive steps in supporting their well-being, including prioritizing immune health. Consider this episode part 3 in my mindfulness series as it relates to chronic disease and infections. Dr. Donnie Wilson is a naturopathic doctor, professional midwife, clinical nutritionist, international speaker, and best-selling author of Master Your Stress, Reset Your Health. For over 24 years, Dr. Donnie has been in clinical practice and has raised awareness of the impact of stress and trauma on our health and how it is possible to recover and become resilient to stress. Dr. Donnie suffered from migraines for many years, and in the process of solving them, she developed her stress recovery protocol. She has used her protocol to help thousands of patients overcome health challenges, including assisting women to clear HPV and prevent cervical cancer. You can find her blog post, her blog podcast called How Humans Heal, and her programs at drdonnie.com. Just a quick medical disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any of my guests on my podcast. So sit back, open your mind, and let's dive into HPV and what all midlife women should know. Hi, Dr. Donnie. Welcome to the Health Trip Podcast.
Hi, Jill. Good to see you. Yeah, it's great to see you. Thank you so much for joining me today. This is a topic that I've wanted to share with my community for a long time and just waiting for the perfect person to come along, and you are it. We are here to talk about HPV or the human papillomavirus and midlife women. And this is a topic, there's a lot of information out there on the menopause metaverse, but this is not a topic that is often discussed. And as a mom to 5 kids and I'm postmenopausal myself, I don't really think about it related to me and my longevity. I think about it for my kids because they have, more multiple sexual partners, and just a different life stage that they're in. And so, what led you to become such an expert in this topic?
It's such a good question. It's one of those things that it's like after a number of years, people would say, "What do you do a lot of?" And I would say, actually, what I do a lot of is helping women when they get an abnormal pap smear. And it started with, I'm also trained as a midwife, so I'm trained as a naturopathic doctor and midwife. So my expertise started in women's health, and then it just turns out that because of the practitioners I trained with back over 25 years ago, also specialized in abnormal pap smears. So it turned out that that was an area that I received a lot of training in because of the mentors that I worked with. And I was one of the only practitioners. I'm still in the New York City area, but I help patients around the world with this. And so, because I was one of the only practitioners with this expertise, a lot of people would refer to me. So over the years, then I would just more and more see more and more women. And I have this kind of personality, and certainly the way I look at things when it comes to health is I inherently believe that our bodies have a healing capacity, and that when we give them the right support, they can heal. And so I just applied that same philosophy to abnormal pap smears. And so when I started off over 25 years ago with helping women with this, I I didn't know what was possible. I was just going based on my training. Like, okay, I know if we use nutrients and herbs, we can support the immune system. And I started simple like that. But the women kept coming back to me and saying to me, what else can we do? What else can we do? And so it was a combination of my belief that the body can heal and my patients coming to me saying, hey, Dr. Donnie, how else can you help me with this? That I then, over the last 2 decades, have developed a protocol where I'm very confident that I can help women to address abnormal cells on a pap smear and to address the HPV virus and get it to go to negative.
I think what's so important in your message is that women have choices, right? Women can go the regular mainstream healthcare route, or they can seek out additional support from a more holistic view. But it's just like in menopause, right? Like, not everybody wants to take hormone replacement therapy, and what else is out there for them, right? There's lifestyle interventions, there's non-hormonal therapies. And I think that women deserve to have these choices and be educated about these choices.
And that's exactly it. It's not about an either or situation.
Mhm.
Of course, I'm also trained to do pap smears. That's in my training as a naturopathic doctor and a midwife. I'm trained to do pap smears, right? And so it's not about either or. It's okay, yes, we're going to go to the practitioner that offers the testing we need. I actually think that as women, we're so lucky to be able to do a pap smear and HPV test so we can get the information, what's going on in our bodies. There's no symptoms. That's the thing. So it's such a silent condition because there's no discharge or burning or pain, or so women don't realize that the high risk HPV virus is causing abnormal cells until they go for a pap smear, and the pap smear allows us to catch it before it turns into cancer. So that's why it's like, yes, go in and find out and do your pap smear now. Really, we also do the high risk HPV test, by the way. They're two separate things. So you would get a PAP and you would get the high risk HPV test. And so you have this, what's called a co-test. You have two pieces of information. I always recommend that women ask their doctor for their test results. So you have it in front of you. And I'm always teaching women how to read. What do the results mean? What is it? What do you go from here? Because what can sometimes happen is the doctor's office, they don't necessarily have time to do a lot of education around this. So your doctor might just call and say, either your pap is normal or you tested positive, and then they might not have time to really explain in detail what does that mean, what does that mean for your health and your risk, and most importantly, what can you do about it. They don't have, that's not part of their training. So really it's about, okay, get the clinical information, and then you're going to want to get the other information so that you can make informed decisions about your health.
Yep, so important. Let's just back up a few steps and even let's just start at what HPV is. I think a lot of people know how it's transmitted, but maybe there are some people who aren't very clear on that. So let's just go through the ABCs of HPV.
Absolutely. And this is the thing, we talk about it as if it's one virus, but it's actually not one virus. There's over 140 types of human papillomavirus. We break it into low risk and high risk. So the low risk human papillomavirus is associated with warts. So there you do get a symptom, is even like warts on your hands or your feet is a type of human papillomavirus, or genital warts. Those are considered low risk because they're not associated with cancer risk. Whereas the types, there's approximately 13, 14, as we know at this point in time, that are high-risk types of HPV that are associated with cancer risk. And so that's just a simple way to just be like, okay, what are we talking about here? A lot of people assume that HPV virus is similar to HSV, which is herpes virus. And they're different viruses. They're different families. It's not the same thing. And every virus that we come across, right, in the world we live in as humans, we're exposed to cold viruses. Now we're very familiar with COVID virus. There's Epstein-Barr or monovirus. There's so many viruses we're exposed to, and human papillomavirus or HPV is I look at it as another virus that as humans we're exposed to, and the high-risk HPV virus we're exposed to through genital contact, because a lot of women will say to me, well, if I'm positive, could I give it to someone by giving them a hug, or can I give it to my child by sleeping next to the child? No, you're not gonna, it's not transmitted that way. It's not transmitted on doorknobs or anything like that. It's transmitted through genital contact. And so that's how we know we get exposed to it. But sometimes we get very, then attached to that. And the thing that's important, because we then think, there's a lot of stigma around it, right? There's a lot of stigma that, this is only people who have numerous sexual partners, or this is only people who are a younger age, so we get a lot of misconceptions and confusion based on that, knowing that it's from genital contact. And the truth is that because I hear from women from around the world every day, every week, because this is something that I'm wanting to break the silence. I'm wanting to open up and listen to the questions that women have and help get the truth out there. And so the truth is that I hear from women who have a single sexual partner and maybe have been married for 30 years and then find out that they're positive for HPV. So it's not about just having multiple sexual partners or being unmarried. It can happen. In fact, what the studies show is that 80% of us are exposed to HPV virus, and especially the high-risk HPV virus, by age 50. So it really then becomes a virus that we're most all exposed to. And it comes down to, we're humans have sex, and we're going to get exposed to this virus. And so it's less about what did I do wrong. It's nothing anyone did wrong, and it's not your fault. And it's that you're human, and humans get exposed to this virus. And from there, the key is to understand that when it's testing positive, it's not just because you were exposed to the virus, right? What the studies also show is that 90% of us will clear the virus to negative within 2 years of testing positive. So what that tells us is that the human immune system can fight off this virus. This is how it's different than the herpes virus. It's not like herpes where it stays around forever and might pop back up again. Human papillomavirus, we can clear it to negative. In fact, the studies show that 90% of cases do. The body gets rid of it. So what we're really looking at is, what about those cases where the body's not getting rid of it? What's happening there, right? That's where I'm really specializing in, is what's happening where women are, it's staying longer than 2 years, or maybe it's staying 15 years. I talk to women, sometimes they've been testing positive for over 10, 15, 20 years. They've been dealing with this virus. So the question is, why is their body not getting rid of it? And that's where the answers lie. That's where we really are able to create transformations, is by asking that question.
Before we dive into that, because that is such a key point that we're going to talk about for the episode, is using condoms one way to prevent the transmission?
Partially. And so a lot of times you will hear from the gynecologist or your midwife to use condoms, because that's partially preventing a genital exposure. But as we know, condoms don't cover the whole genital area.
Right.
So they're not 100% either in terms of preventing transmission.
Right. And then you have same-sex partners, and that's completely different, right? Because for two women, there is no condom.
Exactly. So there's some partial fixes. Even the vaccine is a partial way to address it. Some people say to me, well, if we had the vaccine, isn't that going to just solve this altogether? And certainly, like with any vaccine, it's protecting to some degree for those people who had the vaccine. But the vaccine, as we know it at this point in time, covers 9 of the 13 high-risk types. So it doesn't cover all of them. And the vaccine is not 100% effective. So there's also people who've had the vaccine, the HPV vaccine, and they're still testing positive, and they're feeling frustrated. They're like, hey, I did what I was told to do, and still I'm testing positive. So it's important to know that, and this is on the gynecological guidelines, the official guidelines, it says, even if you have the vaccine, you still need to be tested. You still need to get a pap smear, because it's still possible to test positive. It's still possible to get cancer from HPV, even if you had the vaccine. It's not a fail-safe.
So I remember when my 5 kids all got the vaccine when they were young, like in their early teens, I believe it was. I don't remember it being offered to me. Is it something that can still be offered to women in midlife?
It's at a certain age. I'm trying to remember now what that cutoff is, but there's a certain age that it's considered effective until. So you want to check with your practitioner, and based on your age, if it's something you could still have. But that's the true. If some people, it's like, hey, maybe it wasn't available when you were a teen,
Right.
and now you're like, well, now what do I do? The vaccine isn't an option for me at my age, and so then you're like, yeah, what do I do? And so the doctor might say use a condom, and even that is not 100%. And so to me, I end up saying, again, my mind is always like, what can we turn to that can help us with this? Because otherwise what can happen is we can get stuck in the fear. And this can happen I hear this from women day after day, is how, of course, we're talking about a high-risk virus that's associated with cancer risk, and women are, first of all, afraid to give it to someone else. They're afraid to give it to their partners, and they're afraid of, is this going to cause cancer or ruin my life? And so it can really, dealing with this virus can create a lot of fear and almost make you feel paralyzed in your life. What am I going to do here if you don't realize what options there are for healing? And so I really just want to mention that, because I know there's so many women who are really suffering in silence, because a lot of times women feel too embarrassed to tell even their friends, even their partners, even their loved ones what they're dealing with. And that's why, to me, I'm standing up here for them. I'm saying, hey, this is something that we all need information about, because right now, over 600,000 women are being diagnosed with cervical cancer every year around the world. And I see it from my practice of over 20 years of helping women with this. I see it as something that's very preventable. But women need to have the information to know how to prevent it. Otherwise, they might be in silence, not telling anyone, and end up getting cancer and even potentially dying from this cancer because they just didn't have that information or support.
Yeah. 2 things come to mind right now listening to you. One is, what else happens for women in midlife except for menopause? Well, divorce. Divorce is huge in midlife. I'm one of those people. I was separated at age 48 and had to go out into the dating field again. I didn't really think about this at all, and my doctors never really mentioned it to me either. Definitely not top of mind, but something to really consider as women are navigating the dating scene again, right? And the other thing that came to mind was, oh gosh, I'm having like a menopause moment right now.
That's a perfect example, right?
Totally, right? Yeah, I might have to circle back to this one.
But you're making such a good point, is that we might have a relationship change and new sexual partners, and it is very common. Like, a lot of women assume that HPV is only something that happens in women in their 20s or maybe 30s, right? And then they assume, hey, I'm over 50, I don't need to worry about this anymore. And that's really not true. That I'm hearing from so many women over 50. I even hear from women in their 60s and their 70s, because women are more sexually active later in life now, whether it's from, divorce or loss of their partner and going into a new relationship. And then sometimes it is because they then get exposed to HPV, or the other possibility is even women who are in the same relationship. But what happens when we go through menopause is that one thing is our estrogen levels drop. We know that about menopause is the ovary function decreases, both estrogen and progesterone decrease. But specifically with estrogen, what we know from the research is that when estrogen decreases vaginally, it affects the vaginal microbiome. And the vaginal microbiome is a lot of what protects us from infections, including HPV virus. So if you think about it as, let's say, 10 women are exposed to the HPV virus through sexual contact, but not all of them are going to test positive for HPV. So you can be exposed to the virus and not test positive, or you could be exposed to the virus and test positive, but then it goes to negative very quickly within 3 months to 2 years. Or some of those women are going to get exposed and test positive and it doesn't go away. Well, why is it not going away? Well, one of our protective defense mechanisms for this virus is our vaginal microbiome. This is the good bacteria vaginally that protect us. And the newest research is getting to really clarify this for us, to say that yes, those good bacteria really do an important job of keeping the pH at a level that prevents from viruses from being able to thrive. And what can happen is when the estrogen drops, then the healthy bacteria drop. And also the HPV virus, when it shows up, it starts to make an environment that is good for it. It's like
opportunistic.
It is. It starts to shift the vaginal microbiome to a way that makes it easier for it to thrive. So when we have that combination of low estrogen, so the microbiome is already negatively affected by that, and then this HPV virus shows up and it says, oh, great, I'm going to take over and make this my happy home, then we become even more susceptible. The other thing that affects it is our gut microbiome. So we know there's a connection between the gut microbiome, or the bacteria and the other microbes in the gut. They're related to the microbiome in the vagina. And so the research is so interesting, I think, so if women are having more disruption in their gut microbiome, let's say they've been on antibiotics or acid blocking medications, or they've had bacterial overgrowth or food poisoning, right? Their gut microbiome's disrupted. It's very likely to make them now more susceptible vaginally to HPV. And so these are scenarios that can happen to women after 50 that could be increased. Women will say, how come all of a sudden, now that I'm going through perimenopause or postmenopause, now I'm testing positive for HPV? These are some of the reasons why it starts to test positive, because you're more susceptible. Another big one, Jill, is stress exposure in general. So yes, having a divorce is stressful, so that alone is a big stress that we go through. Also, if there's a loss of a loved one, or say coming through a pandemic, or a stressful job, or a loss of a job, a move to a different home, or something's going on in your family, any of these kinds of stresses also decrease our immune function and increase our susceptibility to infections like HPV.
So you reminded me of what I was going to say. When women go through menopause and they get on the other side of it, a lot of them stop going to their OBGYN on an annual basis. Sometimes they let 3, 5 years go by. And here you are talking about all these changes that are happening in the transition into menopause and beyond. And so they're not really able to track this. Maybe they're feeling, vaginal dryness, painful intercourse, but you're talking about things that they might not be aware of or educated on that are going on behind the scenes. Like I always say, a lot of menopausal women are focused on hot flashes, night sweats, changes in their hair, weight gain, things that we can see that they're tangible. But there's all of these under the hood symptoms and changes going on. And we have to remind women that just because you're not getting a period anymore does not mean you do not go visit your provider.
And if you have a hysterectomy, you still need to get a pap smear. A lot of women by that age may have had a hysterectomy and they think, oh, I had a hysterectomy, I'm done with this now. And it's actually not true, because depending on the type of hysterectomy, sometimes a hysterectomy will remove the cervix and sometimes they leave the cervix. But either way, the high-risk HPV virus doesn't go away when you have a surgery. It could still be there. And so it can cause abnormal cells on the cervix still, if the cervix is still there, or it can cause abnormal cells in the vaginal cells. So even if you had a hysterectomy, it's still important to go in and get a pap smear and HPV test. And the current guidelines say up to age 65. But I think that it really should go beyond that, especially if you know you have any of these risk factors. If you know you've previously tested positive for HPV, or if you have a new partner, or if you know your estrogen's low, or you know you've been under a lot of stress, I would still encourage you to keep checking, because I see women into their 70s who are dealing with this.
So interesting. We're talking about HPV and its cause of cervical cancer, but there are other cancers that HPV cause.
Yep. It can cause cervical cancer is 99% of cervical cancer is caused by high-risk HPV virus, and it's one of the ones we focus on the most. But yes, high-risk HPV virus can also cause vaginal cancer, vulvar cancer, so on the outside area in women. It can also cause anal cancer and oral or respiratory cancer. So I'm hearing from women who are dealing with HPV or abnormal cells that are diagnosed in these other areas of the body. It can also cause cancer for men. So it can cause penile cancer, anal cancer, oral cancer. And the thing is that men don't have an equivalent to a PAP. In fact, in the United States, men are really not tested for HPV unless they have warts that are showing or abnormality, then they might get tested. But in other countries, they're more often tested. But a lot of times men don't know until they get cancer. And so I really hope that changes in the near future, because I would like for men to be able to also know ahead of time so they can take steps to be preventing HPV-related cancer. It's one of the highest, fastest increasing types of cancer right now, including head and neck cancer, because it's not something we're testing for or screening for. So then a lot of women will say to me, well, if I test positive with my pap test for HPV, should I be worried about the oral area or other areas of my body? And the thing I would say is, yes, I would say it is important to consider that. And there are tests available. So I really think the dentist should be doing, all of our dentists should be testing for oral HPV. It's not the standard of care, but you can ask your dentist, or you can also contact my office. There's a test you can do that's a saliva test, for example, if you want to know for sure if you're testing for high-risk HPV orally. So there's ways to find out. You can also test for the anal area as well, if you want to get reassured, right? Because sometimes you just start going, oh my gosh, where's this virus? And we feel out of control. And at the same time, Jill, what I always like to reassure women is that there are ways for us to help our bodies clear this virus. Just because you're exposed and just because you're testing positive doesn't mean that you can't get rid of it. It doesn't, because there's a lot of other myths about if you're older, it's harder to get rid of it, or, if you've had it for a long time, you're not going to get rid of it. I hear all these things from women, and I would just say, to me, none of that is true, because I've helped women of all different ages who've been dealing with this virus for all different lengths of time, and I see it go to negative. So I know it's possible.
Yeah, I want to get into that, but I have a couple questions here that you're getting me to think about. One is vaginal estrogen, right? We know the vaginal estrogen is safe for everybody out there. That has been shown in the menopause metaverse by the leading experts in menopause medicine, that even if you're 78 years old, you can start on vaginal estrogen.
Yes.
Does that help with preventing the HPV virus to survive within the vaginal cavity?
Yeah, and I'm really excited about that research as well, because for many years we were hesitant about estrogen in general and certainly about vaginal estrogen. And now the recent research is really showing that women should be using vaginal estrogen even with a history of breast cancer. Before, we were hesitant about using vaginal estrogen with a history of breast cancer, but the studies are really not showing that it's warranted to prevent the use of estrogen for women with history of breast cancer. Always, of course, check with your oncologist and your doctor. But the recent research is really starting to change our view on this. And absolutely, I see amazing changes when we can add vaginal estrogen to women's life, to their vagina already. Because I talked about how the lack of estrogen negatively affects the microbiome. When we add the estrogen back in vaginally, right away the cells improve and the microbiome improves, and you're going to be preventing high-risk HPV. But when you were mentioning some of the menopausal symptoms, it made me think that a lot of women don't realize that when you're menopausal and you have low estrogen, you're also more susceptible to vaginal yeast, BV, or bacterial vaginosis, as well as bladder infections. So if you're finding yourself with why do I keep getting bladder infections, or why do I keep getting vaginal yeast infections, that tells me likely we have it's a low estrogen situation with the microbiome disrupted, and you now are also more susceptible to HPV. But we can address all of that by bringing back some estrogen. And it doesn't mean we're going to overdo it. It really is about working with a practitioner who can just give you the right amount at the right timing to just give just enough estrogen to improve the health of the vaginal area.
So interesting. I remember listening to a podcast a couple of years ago, and the medical doctor was talking about nursing homes and the elderly women living in nursing homes, and that it should be given, vaginal estrogen should be given to all women living in nursing homes.
Yes. That's
for quality of life and fighting off these infections. So important. Women with autoimmune disease. I think you know Dr. Tom O'Brien,
Yes.
and I had him on the podcast once, and he talked about how midlife women have an increased risk for getting an autoimmune disease, right? Maybe it doesn't run in the family and they never had it before, but all of a sudden now they're in midlife and things are changing. Their gut microbiome is changing, and they're being diagnosed with autoimmune conditions. If someone is dealing with an autoimmune condition, does that mean that they are at higher risk for HPV because their immune system is not as strong as it should be?
It's a great question. I haven't seen a study that's saying that. However, I do see that in the women that I work with, because I'm helping women one-on-one and in group programs and hearing from thousands of women around the world all the time. And so I'm always very interested in what are their stories? What is it that what are the commonalities? What are the patterns that we're seeing? And it's not like, I would say it's certainly not that everyone who has autoimmunity is more likely to get HPV or test positive for HPV. But I do always ask, okay, in addition to testing positive for high-risk HPV, what else is going on in your body? And certainly a lot of women do also have, for example, Hashimoto's, autoimmune to the thyroid, or some of them may have Crohn's or rheumatoid arthritis. I mean, sometimes there is some autoimmunity present, and the way you're thinking about it and drawing that connection makes sense. Actually, when I start to look for what's underlying, here's the high risk HPV, that's really just a symptom, right? It's just showing up as the red flag, the blinking red light. Okay, then we have to look and say, well, why is it there? And we look for why is it there. It's some of the same reasons that autoimmunity is there. The imbalanced microbiome, like you said, the leaky gut. Because what happens with leaky gut is then our foods are inflammatory and they're increasing inflammation in the body. And then there's usually also cortisol level imbalances. And when we have that combination of factors, it does make us more susceptible to infections, including HPV. So it does make sense that there's this, it can become like almost like a stack of things, the autoimmunity, the HPV, and maybe a few other things as well, and like a toxin exposure, for example. And women are like, why is all of this happening to me at once? And that's when, as a naturopathic doctor, I always go, well, let's look for the commonalities. Where these are not separate things. They're showing up at once for a reason. We need to look at what's happening in your body that's making all of this susceptibility show up together.
And is that equation from woman to woman to woman that you work with always different? Or what are some of those common denominators at the root cause level?
I talk about it as 8 susceptibility factors. There are 8 most common susceptibility factors that are the things that I see make women more susceptible to testing positive for HPV. And so it's not that everyone has all 8, but that helps us to think through, hey, maybe you have 1 or 2 or 3 of these. And once we identify them, then we can address them. So it would be things like nutrient deficiencies. A lot of women have nutrient deficiencies without realizing it, even especially iron deficiencies, quite common, I find, in women who are testing positive for HPV, whether that's because of their diet being low in iron or because sometimes women have gone through, especially with perimenopause, maybe they had a lot of heavy bleeding, became anemic and low in iron without realizing it, and then they end up being susceptible to HPV. Also, B vitamin deficiencies, vitamin D deficiencies. So these are I always look for, are there nutrient deficiencies we need to help with so that of course, how's our body and our immune system gonna help protect us if we don't have enough of these nutrients? There's also the imbalanced microbiome is one of the susceptibilities, the hormone imbalance, or hormone deficiency, like estrogen deficiency, or women who are perimenopausal, they may have, estrogen and progesterone that are not optimal, and even the way that we detoxify estrogen. So sometimes women might even postmenopausally be taking hormone replacement, but if their liver isn't optimally metabolizing it and maybe setting up a scenario of having high toxic estrogen, that also could be part of the susceptibility. I'm also looking at things like, cortisol levels. So the stress, how does stress affect our stress hormones like cortisol and adrenaline, and even our neurotransmitters? I'm finding that when women get depleted in, let's say, serotonin and GABA and dopamine, this leads them to be more susceptible because right away we don't realize, right? We're thinking, oh, I'm talking about HPV in the vagina. What does that have to do with my digestion? Or what does that have to do with my nervous system? But again, because I've been working with this for so many years and been a detective in this area and seeing so many women, I end up seeing the connection. I end up seeing, oh, many of these women have depleted neurotransmitters levels. Many of these women may have either high or low cortisol levels. Many of these women have low estrogen, for example, or earlier in life, maybe they have high estrogen. Another one that I see clinically and is also in the research is blood sugar levels. So it's not all the way to diabetes, but it could be. I certainly see women who have diabetes and are higher risk of HPV, but also women who are maybe not all the way to diabetes, but have blood sugar that's fluctuating, or, it's like just a little high sometimes or a little low, but it's just a blood sugar that's a bit out of balance. That also is known to increase susceptibility to HPV. And of course, that happens to women midlife, right? We get these blood sugar imbalances. So these are the stones I turn, right? I'm like, let me turn over this stone and see if that's happening for you. not everybody has blood sugar issues, but if that's part of it, I'm like, we want to address those blood sugar issues anyway for all the other health reasons. But certainly I know that when we get the blood sugar more optimized, that HPV is going to go away because now the body is able to get rid of it.
Yeah. Yeah. Let's pivot to clearing HPV. You've mentioned this a couple times, and you mentioned that some people's bodies are just, well, you gave that example of 10 women. Some women are just going to get it and they're going to clear it. Some women aren't going to clear it at all. The variety of, or the spectrum of clearing this HPV. So start at the beginning of that story of how the body just naturally clears it and what happens when it doesn't clear it, and then move into how to clear it if it needs to be cleared.
So this is a virus that it likes certain cells in the body, as we talked about it. These high-risk HPV viruses, they like the cervix, they like the vaginal tissue. These are the cells they can thrive in. So when it comes into the human body, it's looking for where can it thrive, right? If we think about it from the perspective of the virus, it's looking for, hey, where can I live and do my thing? So it's gonna try to go into the cells of the cervix, for example, and it kind of hijacks the cells. It makes it its own. It even goes into the DNA and it starts changing the cells. This is what we can see when we do a pap smear. We're taking a sample of cells and looking under a microscope, and we're saying, do these cells look like they've been affected by HPV? And the pathologist who's looking under the microscope can see, oh yeah, the shape of the cell, the color of the cell, the nucleus of the cell is starting to change shape and size, and it's looking a little bit more toward a cancer cell, right? So when we do a pap smear, we're looking at it as a gradation from a spectrum, from a completely normal healthy cell to a cell that's a little bit inflamed, meaning the immune system's trying to fend off HPV. And then what we call CIN1, or a low grade, where it's looking a little bit changed by the virus. Then it goes into what's called CIN2 or 3, which is considered a more high grade abnormality. So now the virus is causing the cell to look more abnormal, closer to a cancer cell, but not all the way to a cancer cell. And then after CIN3, it goes into what's called carcinoma in situ, which is the step right before it turns into a cancer cell. So when you get that's why I always want to help women to know, when you get your results back, ask your doctor for the results and know that where are you on that spectrum? Are you over here on it's just a little bit of inflammation, or are you into low grade or high grade, or right before turning into cancer cells? And that's important because then we know how far along, how much has the virus impacted the cells. Now, at the same time,
sorry. One thing is, when most doctors, like you said, they send an email through your portal and it's like, you're normal, right? There's no where on the spectrum you're normal or abnormal. So is that something you specifically have to ask your doctor? And is that doctor trained to actually tell you?
Yeah, I mean, I encourage women to ask the doctor, and they don't always tell you, right? Like they don't often give women their results. So I always recommend the women ask for their results. And then I do a lot of training through workshops and videos on my website to teach women how to understand what your results mean. Because now you're putting yourself in the driver's seat of your health. You're saying, hey, this is understandable. This is not a mystery. This is not too complicated. This is like, if we can understand CIN1, CIN2, CIN3. CIN3 is more advanced than CIN1. Okay, I get it. And if it's CIN1, which is the low grade, then it's not required to have a procedure to remove it. CIN1, it's established that the body can heal it. The body can fend off the virus, and the cervix can grow new healthy cells. That's always a key. I always like to say is like, just like our skin, we grow healthy cells every day. The cervix can grow new healthy cells, right? So the cervix can heal a CIN1. And so your practitioner is not likely to recommend any kind of procedure for CIN1. If it goes to CIN2 or 3, then that's when the doctor is more likely to say, hey, we need a procedure to remove those abnormal cells. And I agree, we want to remove CIN2, 3 before it gets worse. Now, something just to put in the middle there is that usually you go for the pap smear, and the pap smear is a screening exam. It's like, we're just going to take a quick look and see what we see. if they see high risk HPV and if they potentially see any kind of abnormality on the cells, the doctor is likely to recommend a biopsy. And at that point, then they're going to go back in and they're going to be able to look with a special instrument to be able to see where potential abnormal cells are. And they do a biopsy to specifically test certain areas to then get a closer look at those cells. And so they're using it as a confirmation. Is it CIN23? If it's CIN23, that's when your doctor is likely to talk about a LEAP procedure, is what we call it in the United States. Other countries, it's called a LETS procedure or other type of procedure to remove those cells. But the key to know is, and the doctor doesn't always tell you this, even when you remove CIN23, even if you removed cancer cells, it doesn't kill the virus. So the HPV virus can still be there, and it can cause those abnormal cells all over again. So unfortunately, many women are maybe finding out they have CIN23, go through a procedure like a LEAP procedure to remove the cells, and within 6 months to a year, end up again in the same situation because the procedure doesn't remove the virus. And so this is where I just really want women to be like, okay, just, yes, remove the cells. But to me, that's only part of the solution, right? We want to remove abnormal cells, but we also need to address the virus. And so this comes back to what we're about to talk about is like, first of all, to say you can't, there's things you can do, and your doctor is likely not to mention it because it's things that they're not trained in, like dietary changes, nutrients, herbs, stress recovery. These are not part of the gynecologist's toolbox. So you're going to need to go, hey, let me find other help with these things that can help my body address what's making me susceptible, address this virus. Because yes, the immune system, the human immune system can go after this virus using the antibodies, right? Our immune system makes antibodies to viruses, so we can use the antibodies, but we can also use the microbiome. We can also use all these other protective mechanisms that help our bodies fend off HPV virus.
Yeah, and your website, your YouTube channel, your social media is just filled with gems of information on how to clear the HPV virus. And I would love to dive into just some of those therapies or ways in which you work with your clients and how you do this. Let's start with nutrition.
Yeah, because it's not something people might think, well, what does what I'm eating have to do with this?
Right.
And your doctor might, if you ask the doctor, they may or may not be aware of this. What I see, though, is that there's a huge connection between what we eat. Let's start with sugar, for example. We talked a little bit about blood sugar fluctuations, but sugar specifically, like I'm talking about like cane sugar, like a spoonful of sugar, not necessarily fruit sugar, but sugar that you might put in your coffee or eat in a dessert. Sugar itself, we know, drops our immune function for at least 8 hours. So whenever we're consuming sugar, we're already making ourselves more susceptible to any kind of infection. But in this case, we're specifically thinking about HPV. So it's a reason I would just encourage women to start by saying, hey, is there in my diet, where am I getting exposed to sugar that's not necessary? Like a lot of times there's sugar in the ketchup, there's sugar in the salad dressing, right? There's sugar that we're like, or beverages, we're like, I don't really need sugar in those places. Maybe it's not that I have zero sugar in my diet, but what I do is I try to just have sugar in those special occasion places where there's intentionality instead of constant sugar exposure that could be lowering our immune function. Also alcohol. I see this oftentimes with women who are at higher risk with HPV is that they might be having higher consumption of alcohol. We also know that cigarette smoking increases risk. And so if you have a history of cigarette smoking, that could be part of it. And I encourage you to get help with stopping smoking because right away you're going to make a difference with helping to decrease the HPV. But the same is true with alcohol. And we know like for women that, a little bit of alcohol shouldn't be an issue. But if you're having, 1 or 2 glasses of any kind of alcohol every day, it's going to affect your health in many different ways, but including with HPV risk.
So are there any foods that are optimal to help a woman clear HPV? Like, are we talking about, a high antioxidant rich diet and,
Mhm.
clean foods? What are some of
Yes.
the stars that stand out?
I definitely like this concept of clean eating. First of all, decreasing our pesticide exposure, right? Like,
Yeah.
so choosing organic whenever possible. Because that's another susceptibility is when we're exposed to more toxins, we become more susceptible to HPV virus. So we want to have organic as much as possible. And yes, choosing those colorful fruits and vegetables so we get antioxidants. So we're choosing, colorful berries as well as colorful vegetables. At the same time, I find that it's really important, especially for women, to make sure you're getting enough protein. So often I find that women are maybe following a plant-based diet, so they're getting a lot of colorful fruits and vegetables, but they're not getting as much protein and iron and B12. And so that can become a susceptibility. And so we want to also be, yes, choosing those colorful fruits and vegetables, but also making sure you're getting adequate protein with each meal.
Yeah, absolutely. That's something that I talk about often, not as it relates to HPV, but it makes perfect sense. And that's often a great place for midlife women to start because, as we know, many midlife women gain a lot of weight. Their body composition changes, and they gain this around their midsection and grow that visceral fat along with that subcutaneous fat. So we want to mitigate that. And protein is so satiating. It's one of those macros that is. Yeah, really important to prioritize and start with. That you're going to be satiated. It's going to keep you from snacking on the sweets and even the overly salty and processed foods. So yeah, I love that message.
Yeah, and I find that when women come through my Say Goodbye to HPV program where I teach them this, they not only get HPV to negative, but they end up reporting, I
Mhm.
lost 14 pounds that I've been
Yeah,
needing to lose, and my energy's improved, my hair, look,
my
everybody's
hair,
stopping me and
skin.
saying, why do you look so much better? What's going on with you?
Mhm,
And it's
mhm.
because these same dietary changes end up in benefiting your health overall.
Yeah. And so you mentioned leaky gut for earlier, and we know that when we eat more of these antioxidant filled foods, the plants and all the colors of the rainbow, we're getting all of these amazing nutrients that are feeding the good bacteria in our gut. So we have to heal that leaky gut. So we're talking about nutrition, but what about probiotics? Is there any room for probiotics in terms of clearing HPV and healing your gut?
Absolutely, there is absolutely, and the thing is, I mean, you could start with. There's so many now probiotics out
Yeah.
there. There are also specific probiotics that are meant to improve the vaginal microbiome in
Hmm.
addition to the gut biome. So look for like a women's probiotic, and there's actually studies that show that when women take a women's probiotic, it helps to fend off vaginal infections, so yeast, BV, and HPV. So it's like what I would do is recommend like go for a probiotic that's a women's probiotic because likely you need that support vaginally as well, and also to know that it's sometimes not just about taking a probiotic. If there's really an imbalance of bacteria or yeast in the gut, sometimes we need to go through, right, a whole protocol of
Yeah.
getting the microbiome back on track. So we might need to use some antimicrobial herbs and some spore-based bacteria to really help shift the population back on track again, and then shift to a more like a maintenance probiotic for the long term.
Yeah, absolutely. And then what about sleep? Right? We've
Mhm.
talked about nutrition a little bit. What about the impact the sleep has on someone being able to clear HPV?
I love that you're asking about this. It's so true because when we're sleeping is when our immune system is busy protecting us, and we do so much cellular repair while we're sleeping. When we're sleeping well, anyway, right? So when we get a healthy melatonin level and we get a healthy, our cortisol drops and we're sleeping, getting that 7.5 to 9 hours of sleep, that's when we get a lot of healing in that time period. I used to be a person who was like, oh, nothing's happening while we sleep. And now, after researching it a lot, I'm like, no, there's a lot that happens when we sleep. We
Mhm.
really need that. And so, and that's common with also with postmenopause, as women have more issues with sleep or staying asleep. And so, that could also be a contributing factor. And so the more we can help you, to be able to, sometimes it is just your sleep routine, getting yourself into the bed and in darkness and not being woken up in the night. And sometimes it's due to hormone imbalances. Sometimes it's because of estrogen, progesterone, or because of cortisol, and even because of the gut biome, right? So we need to, if you're having trouble with sleep, it's worthwhile to say, hey, what else is going on here? Let's address those things, because likely as we solve the sleep issue, we're also helping you fend off HPV.
Yeah, absolutely. And then let's talk about stress too. You mentioned it a couple times as well, but I would think that a lot of people listening to this wouldn't think that mindfulness plays a huge role in clearing HPV. But not only did I look on your website and your information, but I also dug deep into it in, other scientific literature. And it's true, having a mindfulness practice. And by the way, I'm including this podcast episode as my part 3 in my mindfulness series, in terms of how does mindfulness play a positive role in chronic disease and infection. And this is a great example where creating a mindfulness practice is going to help someone with HPV, clearing it, because like you said earlier in the podcast, people have such shame and fear around it as well.
Yes, it's when I talk to women after they've achieved their negative HPV negative, and by the way, I'm hearing from women who sometimes worked with me 15 years ago, and still they're testing negative. That's what shows me that it's possible to not just clear it temporarily, but to get it to negative and keep it negative more than 15 years. That to me says, okay, we've created a major shift in their body, where their body now knows how to protect them from this virus, even if they're re-exposed, because we've addressed what was making them susceptible, and their body now is able to be in that group of people who, even if they're exposed, it's not able to test positive anymore. And so absolutely, when I talk to those women and I say, what made the biggest difference for you? A lot of times what they answer is to say it was the mindfulness, the meditation, the learning how to take better care of myself. Those things made a difference to me. In fact, they're continuing to practice mindfulness into the future. And I think part of it, Jill, is because dealing with high-risk HPV and this risk of cancer in itself is stressful. And so oftentimes that can, just like any kind of fear situation, right? It wants to take over our brain, and like women talk about how they feel like they just want to cry all day because that fear has taken over, and it's hard for them to separate from that fear. And what mindfulness allows us to do is to be able to step back and to have more awareness for, first of all, what we're feeling in our bodies, also more awareness for what is this HPV virus, and to realize that we have more control than we thought, and we can start making decisions that can have an influence. And so no longer is it just that the virus and the anxiety has taken over, it's that they can say, hey, yes, this virus is positive, and yes, that's a concern, and I'm the person living in this human body that gets to decide what I'm going to do about that. Mm-hmm. And it's mindfulness that really helps women to reframe it in that way. Mm-hmm. And once they can reframe it in that way, then they can become more disciplined about helping themselves and take control of their health again. And so I find that's why it's an essential part of the programs that when I teach women, I'm always teaching them mindfulness, biofeedback, meditation. We use these tools to help them navigate the path to healing.
Yeah, I absolutely love that. I just had a cancer scare. I had stage 1 melanoma on my neck, and I show my scar on social media, but it's about 100 stitches. It looks like a huge Zorro. And it was about 3.5 weeks ago that they removed a golf ball size tumor from my neck. And I lost the feeling in my neck all the way up to my ear and part of my jaw, and it'll never come back. In early 2024, I decided to really focus on my own mindfulness practice. I really didn't have anything intentional in place. And it was really the one missing puzzle piece to my unique health equation. I've been dialed into my nutrition and all the other lifestyle interventions, but this piece was really missing. And as I was healing and as I was looking at this massive scar on my neck, it was just overwhelming to me. In my mindfulness practice, I truly believe first, it helped me get the sleep that I needed to rest and heal at night. It helped me maintain my routine and take care of myself. I was able to prepare before the surgery, before the treatments, to stay on course. And it enabled me to, I believe, heal. My scar it's still visible, but it's in 3.5 weeks out, it's remarkable how well my body took care of it for me. And I remained calm. And I felt that panic, that fear, the shame, the embarrassment. Like, did I want to wear a turtleneck going out? Right. All of these things popped in my head, but my mindfulness practice brought me back to the present moment so that I could just focus on healing.
Yeah,
It's powerful.
it really is powerful. It's like sometimes it seems so simple because
Yeah.
sometimes it's just taking even a couple deep breaths,
Yeah.
and we don't learn it in school. So we have to kind of learn it when we start realizing that it's important. And it doesn't mean that we have to sit in meditation for hours every day.
Right.
It can be
Right.
so simple.
I don't do that.
Right. Yeah, me neither. But it can be so powerful when you start to go, oh, wow, this is allowing me to navigate this path that I have to go down that I don't really want to be on, but I have to. It's my reality. So, how am
Yeah.
I going to help myself to be my best support to myself on this journey? How can I, because as soon as that fear takes over, it rocks the boat. And what happens then is triggering our stress hormones. And once we start triggering those stress hormones again, it's working against us. And this is one of the biggest lessons with HPV is HPV loves it when we're stressed. Because when we're under a huge amount of stress and fear, the virus can take advantage of that. And it does its thriving when we're in our biggest state of fear. And so if we're going to really outsmart, and that's the way I look at this, is we have to outsmart this virus. We have to then realize, okay, I can't let that fear and shame win. I have to be like, okay, I'm going to prioritize myself, and part of prioritizing myself and my self-care is learning to listen to my body and learning to give my body what it needs so that I can be the one determining my future.
I love that. Yeah. Unbelievable. The power of the body and healing. We are coming to a close, Dr. Donnie. Is there anything more about clearing HPV or just HPV in midlife in general that we haven't talked about that you would like to include?
I mainly, anyone listening who's been struggling with this, I just want you to know that there's help, that you're not alone, that you don't have to figure this out on your own. A lot of times women feel like, hey, I'm we're used to doing things on our own, figuring it out on our own. And I want you to know you don't have to. There are people like me, and I'm training more practitioners to do what I do so that women can have help with this. Women deserve to have help with this, and there is a way to support your body to protect you from high-risk HPV virus. That no matter what you've heard somewhere else that it's impossible to get rid of it, I would say that it is possible because I've worked with the women who demonstrated it to me that it was possible. So if you're struggling with it and trying to figure out what else you can do, then I welcome you to reach out so that I can help guide you.
Yeah, I'm going to put all of your contact information in all of the show notes. But I will tell you for anyone listening to this that your website, your YouTube channel, your social media is so thoughtful, and it's such a gentle reminder of how we can take care of ourselves and put the shame and the fear aside and do the work. And sometimes doing the work is uncomfortable, and that's where health coaches come in, like myself, right? Because
Yes.
everybody's path is very different, and we meet you where you're at on your journey. And just making simple changes can be challenging for some people, while others can dive, 5 steps ahead. So thank you, Dr. Donnie, so much for coming on and sharing your expertise on this topic. I know that there are so many golden gems for people to take away and implement in their life, and ask more questions, be more prepared with their provider appointments. And I know that I am. I certainly I am not an expert in this topic, and which is one of the reasons why I really wanted to do this topic, because as a postmenopausal woman, having working in this space for a very long time, and me not knowing all of the nuances about HPV moving forward as I age, there've got to be so many other women out there like that.
Absolutely, there are. And I'm so glad to be here sharing the information. So thank you for having me. And I'm so glad for what you do. Amazing.
Thank you. Thank you for tuning in, everyone. Thank you. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.